In the meantime, for those who are joining us via Zoom, you can write your name and your organization in the chat box, please. That would really appreciate it, so we can know who is joining us so far. So thank you, Marco Guillen from Siren, Valerie Shankman, Efraim Camacho, Kathy Differding, Rebecca Lay, too many to mention all at once, Miriam Hernandez, Irene de Barraicoa, Leslie Toy, Vanessa, Jeanette, Yolanda, Evelyn Carrillo, Magali, Amanda, Ruth Barajas, Carmen, Joe Rendon, Anabela Galindo, Carmen Iniguez. Thank you very much for joining us. So I think we're 5 minutes into this. Why don't we get started with the formal presentation, everyone? So thank you once again for taking the time to join us for this very important presentation. As you know, the Central Valley is one of those regions of the state of California and also the nation with a very large population of farm-working families. But in addition, just the fact that it's a rural region presents a series of challenges and opportunities for those of us concerned about the spread of the pandemic and the impact that it has on vulnerable communities. And we're very fortunate to have with us for this presentation Dr. Ed Kissam from the Werner-Kohnstamm Family Giving Fund. Ed Kissam is a trustee along with Joanne Tilly, who is there in the background. Both extremely experienced and valuable researchers, among many other things, who over the years have expressed a great deal of commitment to the well-being, the welfare of farm-working communities in the Central Valley, but also nationwide. They are among the most knowledgeable researchers and individuals when it comes to understanding the situation of the farm-working families. So I've been very happy to know them now for nearly 20 years and know about that commitment. So what they're doing right now with COVID-19 is also extremely important. And they were very eager to share the insights and research that they are carrying out with us via webinar. So without further ado, I'd like to introduce and welcome and thank Ed Kissam for this presentation. We are going to be having plenty of time for question and answer, for dialogue. So if you have questions down the line, when we get to that point, you can either include your questions via chat, or you can raise your hand in the Q&A and we'll unmute you to allow you to participate. So thank you once again. And Ed, it's all yours. I'll go mute as well.
Good morning. It's great to join you all, and it's great to join CVIIC, which is an organization which we've been really excited about its role in bringing diverse community organizations together in the San Joaquin Valley and the Central Valley to make change. And the reality is now at a point when we're in this all together that it's good to be talking with you all this morning about strategies. And I think the first thing to pay attention to in thinking about strategic approaches to combat a common problem such as the pandemic of COVID-19 is to remember, here's some fundamental points to keep in mind, which is to remember some things about the nature of COVID-19 as a disease caused by the SARS-CoV-2 virus and about the San Joaquin Valley. And I think I'd like to say that here these fundamental points are, I'm going to go deeper into each of these points as part of the presentation. But I think, first of all, it makes sense to remember that there's complete consensus that case investigation and contact tracing is an essential effort to suppress COVID-19 spread. And there's consensus that epidemiologists know that it's incredibly important to move rapidly and do contact tracing thoroughly in order to be effective. As I'm going to discuss, the dynamics of COVID-19 transmission as a respiratory air-transmitted disease suggests that spread within crowded households in the San Joaquin Valley is a real issue. Another really important thing to keep in mind throughout all of this, I think, is that yes, the serious cases are more prevalent amongst older people, but the risks are still significant for working age population. More than half of the actual COVID-19 cases in California and in each local community are actually working age people. In terms of thinking about COVID-19, it's important to remember what is the social economic context of the pandemic. And some of these issues you're all familiar with, but I just want to include them for the record, about concern regarding misuse of personal information, low trust in government, diversity, especially in terms of legal status, and the difficulties faced by low-income wage earners who are strongly motivated to keep working no matter what. Finally, there's some scientific challenges that need to be addressed, and I'll talk a bit about them, which are the limited awareness of asymptomatic COVID-19, where people aren't even aware that they're infected, and the infectiousness of the pre-symptomatic cases, and finally, the consequences of the illness. So, as you'll see, the first half of my presentation is really going to be about the context and the sets of challenges that we're facing. And the second half will be our suggestions and insights about strategic efforts to make contact tracing as effective as it possibly can be in terms of stamping out the virus whenever it reemerges. So, first of all, just a quick overview of the demographics and socioeconomic profile of the San Joaquin Valley Latino immigrants, who are a large and vulnerable population. The valley is diverse. We're very aware that there are other immigrant populations other than Latinos there, but for the moment, I'm going to focus on Latino immigrants, and among Latino immigrants on farm workers, simply because that's where we have the best information. So as you see, these points are crucial. A lot of undocumented people, a lot of people of indigenous origin. The fact that immigrants in the San Joaquin Valley are settled, long-term settlers, members of the community, and that they're aging. The legal permanent residents and naturalized citizens are on the average 46 to 48 years old. And as you know, and we know, many continue to work even as they age, because many have problems with getting adequate Social Security benefits. Undocumented immigrants are on the average younger, but not tremendously young. Amongst farm workers, there's even more farm workers lack legal status. And so this is really important. And the thing that's also important, and it didn't used to be the case years back, is that on the average, California farm workers are 42 years old. So they're not quite so young. That has a lot of important implications. California has been really marvelous in breaking ground nationally and putting a safety net together for undocumented immigrants, but there's still no access to UI, and there's little access to unemployment insurance. Few of the long-term settled immigrants had a chance to get much education in their home countries. So that's an issue that has to be addressed in terms of messaging and responding to COVID-19. And it's also crucial to remember that internet access is uneven and most people only have smartphone access to the internet. You understand this really well, but I think that national decision makers don't understand it so well, which is that even though farm workers are in the essential workforce, there's still uneven availability of work due to COVID-19 having disrupted a lot of the agricultural markets. And then there are, of course, many other low-wage immigrant workers who are at risk also. The healthcare support workers, warehouse workers, and so on. Here is a slide on the basic issue of transmission of COVID-19. And the epidemiologists talk about the basic reproductive rate, which is estimated to be about 3. And that's how many people any person who is infected will go on to infect on the average. There's been a lot of attention to shelter in place and efforts to decrease COVID transmission in the community, but actually the epidemiologists are clear that about 1/3 of transmission is community transmission, about 1/3 is in either workplace or school, and 1/3 in households. And so California's strategy was great in that it eliminated transmission in schools and non-essential businesses by closing them. And the governor's executive order on shelter in place. But it didn't help the issue of transmission in essential business workplaces or crowded households. And now that we're emerging from the first wave, we're getting back to business as usual. So it's been noted that the risks of transmission increasing are quite real. We did some analysis using National Agricultural Workers Survey data on number of people in farm worker households and crowdedness of housing. And we estimated that household transmission is really important in farm worker households, and we think probably in many other immigrant households, because 2.5 times higher than in the average household. What this means then is that this variable, which is called real-time reproductive rate, R sub T, is probably much higher in farm worker communities and immigrant communities than in the average US community. So here are these 2 clusters of transmission risks to address. The first is housing conditions, which is the crowded housing, but also, as we know from working with CVIIC and Sierra Health Foundation and California Institute of Rural Studies on census issues, about 5 to 10% of Latino immigrants live in unconventional housing, such as converted garages, backyard trailers, and so on. Hygiene in those conditions is at best difficult, usually impossible. Then there are these distinctive parts of being a farm worker or working in an actual place where there's physical interaction, and I'm focusing on farm workers. But importantly, we have to remember that riding to work is part of the workplace, sharing a car, farm labor bus, and there's variations in agricultural employers' commitment to maintaining a safe workplace. And on top of that, there's inadequate guidelines from OSHA and Centers for Disease Control. Here, I wanted to give you a look into the very specific conditions of farm worker housing based on some research that that I did with colleagues 15 years ago, but in Arvin, and research that we did pretty recently with the census research and with Sierra Health Foundation. And as you see, the farm worker housing is extremely crowded, large households, and many are in these complex households where there's multiple families under the same roof. I think the best research on this was done by Dr. Rick Mines, who did the Pato Salinas Valley Farm Worker Housing Study. The thing I really wanted to call your attention to there is that in that area in Salinas Valley, 93% of the farm worker housing is crowded, and it's not, there are 5.2 people per bathroom and 2.3 people for each room. This is important because the Centers for Disease Control guidance suggests that anyone who's infected should self-isolate in their own bedroom and have their own bathroom. Not possible when there are 5 people using the bathroom and 2 people in the room, and 16% in the Salinas Valley without any bedroom at all. The workplace, on to the workplace safety component. The official guidance is just too vague and too bureaucratic, and it's permissive. And as has always been the case with enforcement of labor law in rural areas, the level of oversight is inadequate. It's been improved, but it's still problematic. That's another whole webinar to talk about that. A thing I'd like to call to your attention that's really important is that CDC and Cal OSHA guidance both neglect to say that temperature screening is good, but imperfect, because about half of COVID-19 infected people have presented at hospitals without fever. So a word of caution here is to not have a false sense of confidence that temperature screening will do an impeccable job. The guidance also lacks actually scientific findings from Centers for Disease Control itself, which is 40% of transmission is from pre-symptomatic people. And about half of all the cases are asymptomatic. They don't have any symptoms. There's also inadequate attention by looking in a siloed way at the workplace and at housing, that there actually is spread of COVID-19 from workplaces to housing and from housing to workplaces. It's not clear, moreover, the guidance suggests that public health departments will tell ag employers how to do a great job of controlling COVID-19 in their workplace. It's really unclear whether the public health agencies are going to be able to respond rapidly enough to nip transmission resurgence in the bud, or to come up with a very specific guidance that's going to help people think through practically how to make their workplace safer. As a consequence, I wanted to look at and share with you a sense of how the San Joaquin Valley is doing. And this slide shows you some hotspots of COVID-19 based on confirmed cases per 100,000. That indicator is imperfect because not everyone has access to testing. It's uneven, and I and other experts want to caution that we should not believe that this is perfect information, but it provides a little bit of insight. And so as you see, it's not surprising that Lamont and Arvin have fairly high levels of confirmed cases. East Bakersfield also. Farmersville, Lindsay, Why Dinuba is so high deserves investigation. Why Mendota is so high deserves investigation. But whatever the actual case is, these levels of COVID-19 prevalence are much higher than the surrounding county level, which was back on June 1st when I did that previous slide, was around 250 or so per 100,000. It's currently higher, but nonetheless, there are these hotspots that are higher than the county averages. And to give you a benchmark, a very good UC San Francisco study in the Mission came up with a prevalence of 1,400 cases per 100,000 amongst mostly Latino immigrants, many Yucatecos there. And in Immokalee, Florida, which is another major farm worker community, they, as a result of doing good testing, having 2 days of testing in town, not 100 miles away, or I'm sorry, an hour away, 50 miles away, they found 2,200 cases per 100,000. So San Joaquin Valley is better off than urban Los Angeles, but there's some uncertainties about the representativeness of the data. And so, as I note here, there's some other places where it's surprising to see that there's no perceived spread of COVID-19. Is that good luck, or is it lack of access to PCR testing? That is the diagnostic testing. I don't know, but it clearly makes a point that further improvements in access to testing are needed necessarily. You know, a woman from Coalinga felt she had to drive all the way to Salinas to get tested. So, you know, that's too far to go. There's inconsistent tabulation of COVID-19 on the county dashboards. And so it's hard to actually compare things. And there's some other issues to keep in mind. For example, the fact that Kings County has a very high prevalence, apparently, of COVID-19, but most of those cases are at Avenal State Prison. Similarly, in Tulare County, which has a very high apparent rate of COVID-19 prevalence, a lot of the problem infections were in nursing homes. So hopefully there will be research, as there's going to be in Monterey County by UC Berkeley Public Health, to really do good testing of farm workers, which gives a much better idea. Why should Latino immigrants, why should farm workers care about COVID-19? Here are some of the reasons. Few have health insurance. Family coverage is uneven. Many have not visited a health provider during the past 2 years. Many farm workers are men, and men actually have much worse outcomes than women. They're not quite as young as many believe. Many have high BMI, body mass index, and many have high blood pressure. Why do these matter? Well, not all cases are mild. So younger people are still at risk. And farm workers and perhaps other Latino immigrants are at higher risk than some other populations. Men actually have more serious complications than women often, but less of the men have an established relationship with a healthcare provider. Women, fortunately, are in touch with healthcare providers to get maternal child health services, but men less often. The issue of needing to go through a healthcare provider in the first few months to get actual actually tested for COVID-19 was very problematic. And we hear still that people with lower digital literacy or constrained internet access find it hard to get to a testing site because most of that messaging is online. Worries about cost and treatment and the complexities of that mean that many farm workers and many immigrant families probably are reluctant to rapidly seek out advice and treatment. However, an important thing to keep in mind is that earlier care may actually improve outcomes. CDC basically suggested that anyone who was infected should shelter in place at home, and that they would very likely be okay because 80% of the cases are mild, and that they should only seek care when they were in extremely bad situation, breathing problems, etc. The clinical research is suggesting now that maybe earlier intervention will help. So this is an important thing to keep in mind. So what is case investigation, contact tracing? What needs to be done? Because if we're going to figure out a strategy, we need to figure out what problems need to be addressed. So case investigation, just very summarily, is to talk with the people who have been diagnosed as having COVID-19 and see who they've been in touch with. However, mechanical apps, these sort of high-tech solutions don't work so well because some analytic thinking is needed to identify and prioritize which contacts have been close contacts really and likely to transmit COVID-19 and which haven't. Once the cases have been talked to and an idea's become available about who they've been in touch with, then contact tracers go on to talk to the people who that infected person has had close contact with. A key part of that effort is to help those contacts effectively self-quarantine and self-isolate as needed. So moving fast is crucial. Maximum effectiveness is from 2 or 3 days before someone has symptoms to about 3 to 5 days after. After someone has symptoms, transmission can be someone can be recognized as being ill and be cautious. But it's really important to do that rapidly. Another half are asymptomatic or perhaps very mild cases, and they don't even notice. Thoroughness and accuracy in contact tracing is really crucial, because if you only get half of the contacts, those half that you don't get in touch with, go on to infect others, perhaps. Persuasive communication is important because not everyone is prepared to take COVID-19 seriously. Not everyone is inclined to give up work when the family is in really bad shape economically. So contact tracers cannot just be in touch with people, they have to talk with them. Isolation quarantine, and this has to date with states' experience been a problem area, is that people who can't self-isolate or self-quarantine on their own because they live in crowded housing have to rapidly get access to temporary lodging, food support, and have daily check-ins to see how are they doing. Because if they start to go downhill in terms of illness, they really need to get into healthcare context rapidly. So, what's our vision? Everyone agrees that contact tracing is important, but what's special about our vision? I think what's special about our vision is that public health departments are going to have to partner with community consortia and grassroots networks to get it done. They can't just go it alone and ask for help from others. They really need a bona fide collaborative partnership, and they need to hire linguistically, culturally competent people, but they also need to understand that trusted voices have to do in part with the trusted track record of the community organization they're with. And I think it's important to understand that it isn't useful just to get health-oriented programs involved. It really are roles for a whole broad spectrum of service providers and outreach workers. We talked with La Clínica de la Raza in Oakland, which is beginning a partnership with Alameda County Public Health. And they just have begun doing COVID-19 testing at the community health center itself. And that's tremendously helpful because it makes the long path toward case investigation and contact tracing shorter, gets people moved into isolation or quarantine faster, and improves recovery. Organizational diversity is crucial. There's no single group in the San Joaquin Valley or in Fresno County or Tulare or Madera County or wherever that can do it all because it's a diverse immigrant population. Just amongst Latinos, there's a lot of diversity. And then there are large Punjabi, Hmong communities, Filipino communities, and others. Similarly, as CVIIC has learned in its 3 or 4 years of working on immigrant issues and legal advice, it's going to be crucial to go out to outlying areas actually, not to expect people to come to Fresno or Bakersfield or Visalia or Modesto. It just isn't feasible for those families. Everyone agrees that Confianza is crucial, but what does it involve? I think it involves not just the right kinds of community-based case investigators and contact tracers, but also the relationships with the organizations which they're a part of. You know, as you see from the slide here, there are a lot of great partners who have strong existing relationships with families who are trusted, which may not be specifically health-oriented organizations. CVIIC is an example, CRLAF, CRLA, kind. Who can be more trusted than a person who's giving sensitive legal advice on immigration issues? Formal organizations are important, but I wanted to stress that, like CBDIO, for example, Líderes Campesinas, but also informal ones too. The hometown associations, you know, I know that there's Hometown Association of Santa Maria Tindu, you know, San Miguel de Cuevas, San Juan Mixtepec. Those informal networks are crucial also, as are sports leagues, crew leaders, and the tienditas, the corner stores, churches, and other community places where people feel at home. We think that it's going to be crucial to enhance case investigation and contact tracing efficacy, to go from mapping into guaranteed intervention, because the word gets around. If the advice is you should self-isolate yourself, well, then you need help to do it. Case investigators, contact tracers are going to have preparation beyond the 20-hour online technical curriculum. They're going to need to learn how to persuade people to take care of themselves well. It's going to be crucial for these consortia to get agreements to provide whatever support is needed. In Q&A, we can talk a little bit about what's been done in Monterey County on in that regard. But Monterey County, for example, has moved on that front pretty well, though not on all fronts. And the reality also is that contact tracing is not a public health exercise, a bureaucratic interview. It really has to be helping people deal with the challenges they face if they are infected with COVID-19 or if they have been in contact with someone who has. I think that's where advice from trusted organizations is important, and that help is important, not just people who have the language and communication skills. We think that health outreach can be integrated with contact tracing. There can be proactive community messaging ahead of time to say why people should pay attention to COVID-19, why they should talk to contact tracers, and what kinds of help is available, and what are the possible consequences of COVID-19, including follow-up problems. So then the strategy has to be to transform testing and contact tracing from these brief technological encounters into opportunities to talk with people, to build their awareness about COVID-19 transmission, because there are lots of practical questions and challenges in decreasing transmission. Part of the consortia and the network approach to community-based contact tracing is going to have to include messaging also with the Immigrant Resilience Fund partners who are helping people who are undocumented with the problems they're facing in the context of COVID-19. Messaging partners like Radio Bilingüe and the community radio stations where they exist, business ag partners, and local government, which actually has resources that only it has. Here's the level of effort more or less is going to be required. An organization called Resolve to Save Lives, which is headed by a former CDC director, has put out an estimator to look at how many case investigators and contact tracers are needed. And so it looks like around 1,600 may be needed for the San Joaquin Valley. But the reality is that the size of that workforce depends on how many new cases there are each day, each week, etc. If COVID-19 starts to get out of control, the need is going to increase really rapidly. I can share with you all the budget calculator from Resolve to Save Lives if anyone's interested. And the other thing to keep in mind is that it's not just people in the San Joaquin Valley, but you have to look at the demographics and profile of the population that's going to have to be reached. And so we're estimating that at least 2 out of 5 contact tracers would need to have the language and cultural competency and Confianza to effectively reach and engage Latino immigrants. And that's not Latinos, that's immigrants, immigrant households only. Latino households, Chicano, Mexican American households, probably a slightly different story. So the long-term implications are that we really have to reframe the discussion about strategy to combat COVID-19 as a community problem, not as a siloed public health problem. We need to focus on outcomes, not on activities and process. And we need to incorporate community oversight as a quality assurance tool. Mainstream institutional actors still fail to adequately understand how valuable social and cultural capital is. It's not just training, it's relationships that count. So we then have to remember also that COVID-19 is a paradigm case of an illness where social determinants of health play the leading role. in determining both transmission and outcomes. So it's not just delivering information, handouts, basic facts, but moving toward popular education, community conversation. And so that can change knowledge, people's beliefs, their attitudes, their aspirations, what they try to do, and with some support, their behavior. So one of the things I wanted to urge you all to do as part of the civic network is for immigrant advocacy organizations, not just call out for equity and justice in general, but to also prepare to work with all stakeholders to design strategies that really work to combat the pandemic. And finally, there's going to have to be ongoing efforts to change the policy environment. CDC's assumptions have been very mainstream, very inattentive to diversity of America, and in particular, that's problematic for the San Joaquin Valley. But at the same time, at the local level, there's also going to have to be greater transparency and legislative regulatory provisions to make sure that the county public health departments, which are charged with being the leads in combating COVID-19, actually get the job done. So lots to do, and that's about it from me. And let's go on to talking about some of the issues.
Thank you very much, Ed, and his contact information is on the screen right now if you'd like to reach him via email. But we can open up the discussion, question and answer. If you have a question and would like to speak, you can raise your hand in the Q&A section. Otherwise, I can also just read some of the questions that have been raised. Jose Vasquez has several of those questions, and I don't know if Ed will have the information about all of them. But I'll start with one of the initial questions that he has. Jose Vasquez asked, is there guidance for H-2 visa contractors on housing for the workers? Is there data on severity of infection for those hotspots you presented in the previous slide?
There's generic guidance, but there's not specific, easily implementable guidance. And it's a challenging situation because the reality is that, as you all understand, not all agricultural workplaces are the same. There's not a single kind of workplace in the United States. There's not a single kind of agricultural workplace, and so on. So the idea is generally has traditionally been that if there is an outbreak, county public health departments intervene to look at an outbreak and advise the employer, if it's employer outbreak, what to do. So some lessons are being learned from the tragedies of outbreaks in meatpacking sheds, and now we're seeing others in some of the farm worker outbreaks in Washington State, for example, were clearly linked to transportation on a crew bus and so on. So insights are being gained about specific things to do, but it's going to be an ongoing learning process. And I think it's important to remember that what we have to do is to create learning communities so that agricultural employers, farm labor contractors, community advocates, public health specialists, and so on, talk together about what can be done.
Thank you, Ed. He has one other observation, and then I have another question by Donna, by Ruth Barajas, I'm sorry. But Jose Vasquez also comments that farm workers who are potentially infected might not want to find out they are infected because that might mean they would have to stop working. It goes back to one of the issues that you raised about the economic situation of the farmworking families, and the finding out that they're infected would not be feasible since they would lose income for weeks. How could immigrant advocates, the partners who are now online, how can they respond to this concern? What can we do, or what do we know about this situation when farm workers and others are really unable to lose income over a period of several weeks?
Yeah. Well, let me say that loud advocacy helps. In Monterey County, I think one of the really good things is that Luis Alejo, as supervisor on the County Board of Supervisors, was early on a very forceful advocate for availability of temporary housing. Shipper growers and other large agricultural employers in Monterey County made commitments to secure housing themselves for their own workers and for farm workers. And Monterey County actually made progress on that. What's possible in the San Joaquin Valley is probably going to vary from community to community and from county to county. But I think that nothing should be off the table in terms of potential resources for temporary lodging. At the same time, it's on the policy front, it's important to remember that the House passed the fourth round of COVID-19 emergency response, which is called the HEROES Act. And that bill, which may or may not be taken up by the Senate, had $75 billion to fund testing, case investigation, and contact tracing. I think that it makes sense to join with other advocates, and Congressman Rush from Chicago was one of the really outspoken and effective advocates on this, to say, well, if there's going to be case investigation and contact tracing, let's make sure that community networks are involved. And let's make sure that some of that $75 billion in funding is made available to assure that people are guaranteed a place to go and some assistance in keeping their household functioning while they're isolating or quarantined. I think the other thing, frankly, that needs to be addressed is to remind people that actually the period for quarantine or self-isolation is not really that long. It's about a week. It depends on how long from when the person was infected to when they got tested to when they got diagnosed, etc. But it's not really so long. So these dislocations in people's lives, by actually being cautious and careful not to then infect their family members or friends or coworkers, isn't so long. So I think that can be addressed, but it really has to be addressed with a very strong commitment to just doing it.
Thank you. We have another question from Ruth Barajas, also related to housing. Are there any special partners or alternatives that are surfacing to support housing needs for undocumented individuals who need to isolate, who may be hesitant to voluntarily go into a government-managed facility?
I'm sorry, say the question again, Jesus.
Are there any special partners or alternatives that are surfacing to support housing needs for undocumented individuals who need to isolate, who may be hesitant to voluntarily go into a government-managed facility?
Yeah. Well, yeah. Some places have made use of under-occupied hotels and motels. there's some advantage to the idea that if you have community-based contact tracers, that they can directly set up arrangements for someone to self-isolate or self-quarantine, and help families make the decision as to whether it might be better for the whole family who's not infected to self-quarantine as opposed to the person who is infected self-isolating. So I think that it's a strong argument for community-based organizations being in there as case managers to make that happen without it being a whole bureaucratic transaction with applications and waiting lists and stuff like that, because none of those provisions are going to actually function in this context.
Thank you. And I apologize if there's background noise on my mic. There's apparently construction going on in a neighboring house. So Dana Olivera has another good question. As our communities open up, what safeguards should we be demanding from public health for farm workers?
Well, I think one of the areas that public health departments have not gotten into adequately is in urging employers to take the best possible steps they can, etc. That kind of messaging and that kind of persuasion, I think, will benefit from being proactive, and also from county public health departments and hopefully the community consortia they're working with to set up forums for employers to talk with each other about how to best respond. For example, I noticed that CRLAF had raised issues about the particular high risk of field packing lettuce. And I noticed in some news coverage in Monterey County recently that actually some employers are now using plastic shields to decrease side-to-side transmission of people between people working next to each other on the mechanized field packing of lettuce. So that's an innovative solution. Actually, I'm a pilot, and part of the aviation community started making plastic face shields and so on. It's really an occasion for entrepreneurial efforts, and I don't think that local government needs to be responsible for saying everything that should be done, but I think they are responsible for building community dialogue and providing advice and expertise in that community dialogue.
Thank you, Ed. A question from Alma Martinez. She says, hello, Dr. Kissam. For quarantine after a positive exposure, can federal funding to counties be used for undocumented workers and farm workers needing temporary lodging? And are you aware of any organizations besides the state aid providing monetary assistance to undocumented workers during quarantines? So it's a two-part question.
Well, the issue as to whether federal money can be used for supporting quarantine and so on is, of course, an incredibly legally fraught question in the current administration. Historically, there's been some precedents where things that benefited the community at large didn't have to give attention to immigration status in terms of who benefited. Whether that's feasible now or not, I don't know. But there are no constraints on state money being used for that I'm aware of. Our friends at CRLAF and CRLA and ILRC and NILC are much more expert on that than I am. But I think that state money can be used, and if it comes to pass, that the current partnership between philanthropy and California state government to support undocumented immigrants moves forward, is I'm afraid it may have to, as we're going to have further waves of COVID-19. I think, one of the issues that the philanthropy community and the state will have to discuss is how to assure that that these that places for quarantine and self-isolation are available. And about, is there any help being given currently? I think that at least through the Immigrant Resilience Fund, a family where someone is ill with COVID-19 and can't work and so on should surely be in line for the overall assistance that's being given to undocumented families. Some of the point behind that was that some people, undocumented workers in businesses that closed down, would have no income. But by the same token, a worker who's forced to self-isolate in their family, who's forced to self-quarantine, also lack that income. So I think, further discussion of the details of that support are merited.
Thank you, Ed. Before we go to the next question, I wanted to comment to the colleagues who are with us at Zoom. Some days ago, I shared via our listservs a link to a survey about the interest of organizations to become involved in collaboration with county health officials on COVID-19 contact tracing. I have included the link to that survey in the chat box in Zoom. So if you have the chance to answer a few questions in a couple of minutes, it would be greatly appreciated, because CVIIC, like other organizations, has been having contact with publicly elected officials, funders, and organizations about this possible collaboration that could take place. And I'm wondering right now if anyone who is currently with us in Zoom is actually collaborating with a county health department on COVID-19 tracing. Are you currently involved in that type of work? And if so, how did that work come about? And if not, are you interested in developing that type of partnership? Because as Ed has pointed out, and several other people have commented, the importance of having people who are culturally competent to be able to carry out this work, culturally competent, is very important. So there's the link if you're able to fill out the survey. But if you'd like to comment also in the chat box, that would be appreciated. So we'll go to the next question that is also related. It's by Beba Islas. She states, as we move to building a public health workforce to conduct testing, treatment, and contact tracing, immigrants are best positioned for these positions, given their cultural and linguistic proficiency. The challenge is for those who legally cannot be hired. Is there any way to facilitate accelerating ITINs or other workarounds for employment given the crisis at hand?
Yeah, well, that's a really good question. I should tell you that we've been discussing with a national organization, which is called Resilience Force, that was set up to respond to emergencies that affected immigrant communities, actually after Hurricane Katrina in New Orleans, about that. And one option is to have a community service corps, which is a COVID-19 community service corps, which provided people stipends to participate in it, very much along using the model that UCLA Downtown Labor Center did in partnering with nonprofits throughout California to employ, dreamers in nonprofit positions. So there is that option of a mechanism that would rest on stipends rather than salaries. And moreover, I think one possibility, and this is a possibility that an organization, Immigrants Rising, has been exploring very heavily, is the possibility of immigrants having their own businesses as LLCs or collectives or whatever modality, but having their own businesses. And if there are immigrant businesses which would be motivated, competent, and energetic in doing the work, then outsourcing some of the contact tracing to them might well be a really viable model.
Thank you, Ed. We have two examples in Stanislaus County and also in Santa Barbara of local organizations that are working with the respective counties' public health departments. So thank you, Vanessa and Perfecto, for pointing that out. Dana Oliveira has a question. Do you know what type of efforts the Strawberry Commission is working on, especially for providing support for the smaller farm employers? What is the Commission's responsibility to farm workers and employers?
Yeah, I don't know. I don't know enough about it. It's a great question. I wish I knew more, but what I can say is that the Strawberry Commission has been one of the more proactive employer associations in seeking to get support. And we know that some of the large berry producers are, for example, making temporary lodging available to their employees, providing support while they're self-quarantined if need be, and providing medical surveillance for those people. So some employers are moving forward to doing that. NPR has reported on some of those efforts and so on. And I think it's a thing where we should all be sharing information. I look forward to being in touch with Lupe Sandoval at California Farm Labor Contractors Association to see what in his particular network different people may be doing.
Thank you, Ed. Any final questions or comments from our colleagues, or any concluding remarks, Ed? If you could go back in your slide presentation to the last slide with your contact information.
Yeah, let me see if I can do that. I think I lost my way there. I did something.
Okay, well,
lose it.
Let me just mention then to our colleagues who are still with us in Zoom that we will be uploading the presentation and also the video recording to the CVIIC.org website. So as soon as Ed approves the final version of the presentation, we will also send it via email to the people who registered for this webinar, so they can also have it because several people have requested it. Concluding remarks, Ed.
Thanks. And just one last pitch to everyone who's participating here, which is I think that you really need to reflect about what exactly you might be able to contribute in any one of these areas, because not everyone can do it all, but everyone has something to contribute. And in particular, and it's sort of related to Perfecto's comment in the Q&A box, which is that the real crucial thing is the enthusiasm and ability to communicate in a friendly, informal, but knowledgeable way with people in the community. It's going to be really, the experience has been that non-formal networks always work best, minimizing, formality and so on works best. And I'm hoping that now as California opens up, one of the things that will be possible will be for people to talk one-on-one to and so on, using social distancing and masks to be in touch with people and start taking advantage of the opening up, not just to go onward with business and getting one's job back, but also in working together to combat the pandemic. Another issue that will be really crucial is to get public health departments to be providing enhanced training to community-based contact tracers about the technicalities, the software they're using, about the importance of confidentiality and so on, because one half of the equation is the ability to persuade people, and the other half is the ability to listen well, collect thorough and accurate information, and keep it confidential, and move rapidly to help people do what they need to do to keep themselves, their families, and their coworkers safe.
Well, thank you very much, Ed. One final announcement to our colleagues. As probably all of you know, one of the things that we're waiting on right now is the Supreme Court decision on DACA, a program that has benefited close to 700,000 people nationwide. The Supreme Court will be making a decision anytime this month. Monday and Thursday of next week being potential dates when that announcement has to be made. So obviously we're very concerned about that decision, the impact that it's going to be having on the families nationwide, but also here in the Central Valley and other parts of California. So we and other organizations have been developing some preparations along those lines, which include some activities, some actions that we can take on the day when that decision is made and afterwards. So please be tuned in for whatever may come up. We have the different listservs that we have in order to be able to provide the assistance, the information to the DACA recipients and their families as soon as this decision is made. We are optimistic about a possible decision that DACA can continue, but we also have to prepare ourselves for a worst case scenario in case the Supreme Court decides that DACA can be terminated. So let's stay in touch and let's continue to prepare ourselves for those circumstances. So thank you very much, Ed, for this excellent presentation. Thank you to everyone who was able to join us for today, and we'll follow up on this topic because this is a very important issue that we all need to be continuously informed and updated about. And we know that the pandemic is not ending anytime soon, so we'll have to continue to be alert and collaborating on this effort. Thank you all very much. Thank you, Ed. Thank you, Joanne.
Bye.